Welcome to Anatomy. FMGE, NEET, Next 2024. PG exclusive test series. Today's MCQ from Abdomen, and the question is: which of the following statement is most accurate regarding the testis? And the options are: A. Vas deferens begins at the top of the epididymis. B. Dartus muscle is situated beneath the cremasteric fascia. C. Lobules of a testis are separated from one another by septa. D. Tunica vaginalis is found beneath the tunica albuginea. E. Lower part of the testis is linked to the appendix testis. Coming to the option A, states that the vas deferens starts at the top of the epididymis. So, what is epididymis? And what does it have to do with vas deferens? The epididymis is a lengthy tube with a convoluted structure that is responsible for storing sperm and transporting it from the testes. Each epididymis is a comma-shaped organ that sits on the back of each testicle. Its head lies near the superior pole of testis, body along the posterior border of testis, and tail at the inferior pole of testes. Then it ascends or continuous as ductus deferens or vas deferens. So the given option A is wrong with the question. The second option B states that the dartus muscle lies beneath the cremasteric fascia. Coming to the explanation. The scarpa's fascia, which is located along the anterior abdominal wall, extends right into the dartus fascia, which is located on the penis and scrotum in males. This fascia is also called as scrotal fascia. It is possible to see the dartus fascia all the way deep to the skin of a man's penile shaft, prepuce, and scrotal sac. The dartus fascia of the scrotum is primarily composed of smooth or dartus muscle and elastic fibers, with very little fat in between them. This fibromuscular fascia forms an incomplete scrotal septum, which divides the scrotal sac into two halves, and places a testis in each one of those halves. When viewed from the outside, this septum appears as a skin ridge that is referred as scrotal raphe. When the dartus muscle contracts, it gives the scrotum its wrinkled appearance. The dartus and cremasteric muscles work together to keep the testicles at the ideal temperature for spermatogenesis. The dartus muscle pulls the testicles in towards the body in colder weather to keep the organs warmer. However, when temperatures are higher, they loosen the scrotum to promote heat loss. 3 layers cover the scrotum below the dartus fascia. From superficial to deep are: 1. External spermatic fascia, comes from aponeurosis of external oblique abdominis muscle. 2. Cremasteric fascia and muscle, from aponeurosis of internal oblique abdominis and transversus abdominis. 3. Internal spermatic fascia, comes from the fascia transversalis. And, finally, 4. Tunica vaginalis, the peritoneum. Females have less developed dartus fascia beneath the labia majora. So the option B is also wrong with the question, because the dartus fascia lies above the cremasteric fascia. Now, I will discuss the option C. And the given option is: lobules of a testis are separated from one another by septa. Male reproductive glands called testes are found in the scrotum, a saccular extension of the anterior abdominal wall. Testicles are oval or spherical, and 4 to 6 centimeters long. Before birth, the testicles form in the posterior abdominal wall, and descend into the scrotum. Each testis is surrounded by 3 coverings, from outside to inside are: 1. Tunica vaginalis, the double-layered peritoneum, that come along with descent of testis. 2. Tunica albuginea, thick whitish-colored fibrous coat. 3. Tunica vasculosa, contains vessels that supplying the testis. The tunica vaginalis is a double-layered peritoneal cavity that contains the remaining lower part of the processus vaginalis. It's invaginated by the testis behind. It has parietal and visceral layers, separated by a possible cavity. Thus, the tunica vaginalis entirely covers the testicles. The testis is encased in a thick, dense layer of fibrous tissue called the tunica albuginea. On the posterior border of testis, the tunica albuginea is thickened, to form an incomplete vertical septum, called the mediastinum testis. Numerous incomplete fibrous septa extend from the mediastinum testis, and divide the interior of the testis into 200 to 300 lobules. Each lobule contains 2 to 4 seminiferous tubules, that produces spermatozoa. To all aspirants, now I and you are going to discuss the option D. Tunica vaginalis is found beneath the tunica albuginea. Because I recently talked about this possibility, while defending choice C. So, scroll it back for the explanation of option C. I really need a response from you this time. Yes, you're absolutely correct. Say it out loud. The tunica vaginalis, which is the peritoneal covering of the testis, is always observed to be situated on top of the tunica albuginea. Thus, option D is equally inappropriate for this question asked. Now coming to explanation of option E, that is, lower part of the testis is linked to the appendix testis. Now, what is appendix testis? Appendix testis, also called as hydatid of Morgagni or testicular appendix, is a remnant of embryonic duct, seen on the testes. About 76 to 83% of those assigned male at birth actually exhibit this trait. The appendix testis can be bilateral in 69% of cases. The length ranges from 1 to 7 mm. It is a developmental leftover from the paramesonephric, or Müllerian duct in an embryo. A testicular appendix is usually found on the upper pole of the testis, inside a groove that runs between the testis and the head of the epididymis. In general, testicular appendix alone have no clinical importance. On the other hand, if they are worsened by testicular torsion or twisting of the spermatic cord structures, venous congestion, arterial input loss, and ipsilateral testis ischemia, can cause severe scrotal pain. Color Doppler ultrasonography can occasionally detect blood flow inside testicular appendages. So the given option is not fit with the question again, because the appendix testis is present on the upper pole of the testis. Every potential course of action has been discussed at this point. Maybe some of you did, maybe not. Option C may or may not be right, but I didn't say so when explaining it. In this case, therefore, the correct answer is choice C, that is, lobules of a testis are separated from one another by septa. Subscribe, leave a comment, give it a like, and share if you enjoyed it.